Shape.
What's that?
You're so in shape.
Oh, I don't feel like it. Dan's been telling me I can't weight lift yet.
Okay.
Yeah, so you've been weightlifting for a while, right?
Yeah, I started weightlifting when I was 12.
Yeah.
And then I've had to not. I don't love it.
How is your low back?
So, what's up?
How's your low back?
Like right now? That's fine.
And Kathy, if you could just
What am I doing?
just say what you're doing while you're
Or
doing
you-
it. Yeah, we're filming.
Kathy's favorite.
Okay. So I'm just noticing some gluteal tightness in the right lower quadrant, more specifically in the hip, probably sacral plexus. And no pain back here?
No.
Okay, good. I'm going down to the pubis to see if it's level. It's a little bit uneven, but I'm gonna leave it for now. Let's go up to the base of the skull and see what's going on here. What's wrong with this thing? All right, so now I'm just gonna go down to the foramen magnum. My fingertips are following the contour of the posterior side of the head, under inion, all the way to the condyles, as close as I can get to them. Just kind of get a sense of the head. Her head has actually softened over time since the beginning, because it's not as compressed anymore. She used to have 4 strain patterns, right?
Mm-hmm.
And now she just has the compression, which is not as bad.
Okay.
Because of all the work she's been doing, the nasal releases. So we can get a good sense of how the dural tension or reciprocal tension system is by putting my fingers on the RCP minor.
Mm-hmm. On both sides?
On both sides. And then if I gently push into them anteriorly from here, see which one is a little tighter. And it feels like the right side is tight.
Mm-hmm.
You can tell?
Yeah, and I was laying the other day like at a place that has like different saunas, and I had my head like in a, I don't know, this little like wooden thing, and I had a lot of tension on the right side of my head that I tried to work out.
So, is there a restriction coming from superiorly to this point, or is it from caudate? So if I push into it, the RCPM, and I let go gently, I just see where the finger travels. Does it go up or down?
Mm-hmm.
Superiorly or inferiorly? And that'll tell me where the restriction is coming from. I'm gonna try again. And sometimes I can't feel, if I'm compressing and trying to provide force and analyze at the same time, I can't do it. It's too much for one finger. So I will feel with my third finger on the right and compress with my third finger on the left. And I feel like it's coming from somewhere in the lower cervical spine or the thoracic outlet, which we know has been a problem. So let's go down to C1, see what happens. checking for range of motion. She's rotated left there. So is T2, T3 is fine, T4 is fine. So is T5. Let's see what happens at C6, C7.
So you're just going into kind of a flexion or extension or flexion, side bend, rotation, and then extension, side bend, rotation of each segment?
Yes, I'm putting the vertebrae in extension.
Yeah.
And then testing its ability to glide on the one above it. So C7 is the same thing. It's rotated left so far in this test. Her C5, same thing. C4, same thing. So she has stacked FRSs on the left. So her vertebrae are flexed and rotated left. They're also side bent left. What muscles do that?
Side bend, rotate left.
Uh-huh. What holds us in this position?
Let's drape your feet over the ball.
Would it be,
Close to you, comfortably.
What muscles do this?
Arms are by your side.
rotate left and side bend left?
Center of gravity. So
SEM, scalene, medius.
Scalings and a little bit of upper traps as well.
So now as you lift, energy is going
Scalings?
back to the shoulders, into the posture muscles, and you're stretching.
How are you here?
The hardest part of this is
Um,
the back of your hip
It's
joints.
okay, I feel it a little bit in my ear.
Put your focus down by the
Alright, so SEM does side bend left, rotate right.
Right.
But I'm sure it's involved too,
Mm-hmm.
to some extent. Alright, so there's that. How about C3? C3 is fine. C2. Rotated right. Let's look at C1. Relax your neck. So I have my fingers on the transverse processes of C1 because I don't want to blow past any restriction. She's restricted on both sides actually, but worse on the left.
Back feel with it. So we're going feet now on the front corner of the ball. So feet go, yep, right about there. We'll move the ball just a bit more so that the knees can start right about here. Okay. Same ask. The ball doesn't move.
Okay. And so when I test C0 on the atlas,
It stays. You go up.
she's restricted in front of the condyle and behind the condyle on the left. So probably out of all of the somatic dysfunctions that I've just identified, that one's probably the worst one. So I would start there.
The CO.
C0 on,
Okay.
on atlas. So let's restore that motion.
You got this. Two more, a little bit more power in the hips, a little bit more focus on the pelvis. A little less back, a little bit more in the lungs, a little bit more underneath it. There you go.
Okay.
Final time, take that up, see if you can hold it again. Now
Push
roll
your
it
head back into the table. Relax.
Yes, yes, get the juice in the spine. Do that two more times.
So for her, that's a little too hard. So I'm just gonna have her use her eyes, look up toward me. And relax. Do it again.
That's the best one. Oh, how come we waited for the last one?
And
All right,
and do it
here
again.
you go, two more. I just did a few extra. Spine close, back the shoulders, back a smaller muscle.
Tuck your chin down.
Large comes down, KO.
Relax. Look up toward me. And relax.
So you're using her eyes to help with the
With the
adjustment?
extension because of the oculocervical relationship.
So looking up, is it gonna extend
It's
the
gonna
spine?
extend the,
Sure.
yes, it's gonna fire them so that you can contract and then relax.
Yeah.
Organized.
So if we retest,
So we're gonna do a little work on the side of the body.
better.
Given the
Okay.
past.
So let's work on C1 now.
Tissue that may or may not be present in the low abs, and we just don't want it to happen again, right? So we're gonna work on the side of the body. Roll to one
sure all the lower cervicals are locked out. Look right. And relax. Look right. And relax. Inhale from here.
So you wanna find your side, you wanna get really on your profile.
So in that position, you're asking her to look right. Do you want the vertebra to go right?
No, this is just upper cervical.
Okay. So it's still atlas you're trying to change?
Correct.
Yeah, so that
Okay,
work is
look left.
yeah. So as you lift and then lower, you
And
might
again.
leave the legs slightly forward so that you feel the abs, not the back. But you wanna lift.
Right. Now, let's work on C7. Let's see if that helps. Sorry if I'm pulling your hair. Yeah. Tip the top of your head to the left. And relax. Do it again. And relax. So sometimes if you work on the very bottom vertebrae, it'll correct all the ones above it.
Mm-hmm.
So that you don't have to go through each one.
Yeah.
But then you have to retest and see if it made a difference. It's still tight on the left. So let's just stretch all of the scalenes on this side. Gently push or turn your head left. And relax.
So this
Now I
is
can
contract,
also-
relax, kind of. This is just to
Yeah,
relax
this
the
is
muscle.
also muscle energy, but it's just to lengthen.
Yeah.
So I'm holding down the first and second ribs.
Mm-hmm.
Turn left. And relax. And again. Are you hurting? You okay?
No, good.
So retest. How's it feel?
Up there feels good, but it's kind of turning on this, which has been kind of hurting on and off this week.
Okay.
Dan said it was Terry's.
So, where are we now? T1, T2. All right. And point to where you were hurting again.
It's right in a few of these spots. It goes like kind of up and in.
Okay, so let's investigate this. Do the woe is me. There you go. Is it in here?
Yes.
What about here?
No. It feels like it could be under it. No.
Okay. Here's rib 1. How about this one?
A little bit, yeah.
Okay, here's rib 2.
More so
3.
there, yeah.
4. Okay. So let's bring this down. Anything here? Not really.
Not as much now.
Okay. Let's, I was thinking maybe it was pec minor, but she's not having any pain there, so.
If you, cause I try to like work it out, it's like lower in my back that
Okay.
makes this worse.
Let me still look at ribs 1 and 2 on the left, because we know T1 and T2 are not working right. So maybe the ribs are involved on the left. So her sternum, or the sternocleidomanubrial joint, it's rotated left. And how far down does it go? There's T7. Pick your head up off the table. And down. Again. And down. Do it again. And down. Maybe sit up for me. You can go that way so that you can sit. Okay, so here, her left clavicle is flexed, right? We know T1 and T2 are rotated left, but are they flexed and rotated or extended and rotated? All right, go ahead and slump. Actually, scoot left because you're on the crack, and I don't know if that's gonna mess up our diagnostics. Go ahead and slump. Am I explaining things okay?
Yep.
All right.
This is the one you showed me recently.
I'm trying to see if her ribs are luxated, maybe?
Yeah.
Okay, so here's C7, inflection, she's fine. She's okay. T3 starts turning. But it actually looks okay. Go ahead and sit up. Now, arch your back and look up a little bit. Okay, so in this position, T1 is rotated left. So is T2. So is T3, T4, T5, 6, 7. Down to 7.
And then here, it hurts here.
And it hurts between the shoulder blade and the spine. Put your left hand here. Good. So, are you tender there?
Yes.
Okay, so her longissimus thoracis?
Yeah.
Yeah.
Be low rhomboids too, but yeah.
Probably should needle those.
Those are like every week, every day.
That's what you'd been complaining that they grab, they're always on, right? Those.
Yeah, and it's gotten better, and it's been more of just this. But I mean, I know it's always there's always tension there. It's just it doesn't always hurt anymore. But when we needle it, I feel bad. Like I feel really, like really dizzy, really unstable.
When this is
nauseous.
needled?
Yeah,
When was the last time it was needled?
maybe like a month ago.
What would that be?
Why?
Why would she be?
I don't know.
Okay. Is it needling here or is it anywhere up in here?
She's got.
Oh, the
it's
Lyme.
Lyme.
Yeah.
I think that complicates things.
Yeah.
I think.
Okay. All right, so where are we? T1, T2 are stuck,
They're extended. They're
flexed.
in extension. They're rotated left. You said.
Correct. So they're stuck in flexion and rotation left. Okay. Okay, so we need to fix that. Okay, so let's start with T2.
Is that an FR?
FRS left.
Left. Right.
Okay. I'm gonna get close. So let's start with her head down in flexion. Go ahead. And then I'm gonna move you up until I feel a barrier, which is right about there. So she's pretty flexed. She's down here.
Mm-hmm.
Right. Gently tip your head into my fingers. And relax. Let me move you. Do it again. Did you guys learn muscle energy yet? Or already?
Some of it.
I use it a lot, every day.
Yeah.
Inhale,
I've been using it more and more.
Yeah, I really like this one.
relax. Okay, good.
This is you practicing the beginning of that process.
Okay, so earlier, I'm sorry, tip your head to the left. And relax. Do it again. And relax. And again. And relax. Now, push your forehead forward. And relax. Good. All right, that's better. Now that the spine is better, let's look back at the ribs and see what's happening. Okay, clavicle's still flexed. Here's rib 2, elevated on the right, on the left. Bring your head down, all the way, good. Still elevated in flexion. Bring your head up and back. Okay, still elevated. Come back down. Let's look at rib 1. Bring your head down, and up and back. Okay, so both ribs 1 and 2 are still elevated in any position of the spine. So is this because she's rotated, or is it actually luxated?
What's this luxated mean?
Dislocated.
Oh,
Does this hurt? Here?
a little. It's not like pain, it's just like tightness.
I think it's actually not dislocated, just because I think her sternum has warped over time. It's gone through some osseous remolding, so I mean, she's had this rotation for a while. So I'm not going to try and fix the ribs because they're actually in place. But this clavicle could use a little bit of help. If we look at her ribs, I'm sorry where my hands are.
That's okay.
Right under her chest here. Lean right. And now lean left.
Yeah.
Okay, so do you see the difference?
Right and left?
Yeah. Let's lean right. She stops right there.
Yeah.
And let's go left. So she keeps going.
Yeah.
On inspection, I feel like, and I see that her ribs on the right are flared. Okay,
Yeah.
so there's a scoliosis going on here.
Yeah.
So if she leans left, the thoracic spine, these ribs are going to internally rotate and flare. These are going to evert and turn in. So this is probably part of the reason why this won't turn off, the longissimus,
Okay.
because it's contracted. Okay, so how can you fix this, right? Is it, she's fine this way, but she has a restriction going this way. So we can actually remold those ribs using muscle energy, but this is actually what's called intraosseous technique, where you're imparting a force through the rib so that you remold it. And if you do it if it's done three sessions in a row, you can actually make a big difference.
Okay.
So how should we do this? Maybe sit here. Oh gosh. Maybe I need to break this up. Let's think about this for a second. Okay. So if you look down, if you were to remove her head and look down on the thorax, her left ribs are like this, and the right ribs are like this. I'm exaggerating just so you can understand. Okay. So we want to compress here. Actually, we don't really want to compress. It's more so you want to expand on this side, right? So, how do we do that? put your hand right here. Okay? So my hands are around the ribs in the front, and then the back. And my thumbs are on the lateral aspect of the torso. Okay, and I'm going to have you lean right. Lean right. Okay, stop right there. I gotta think this through. I don't do this one every day, but. Go ahead and push your arm down into my shoulder. And relax. And let's move you this way. Let's lean right a little bit. Right, good. And do it again. Good. And relax. Lean right. Good. And I'm going to put you a little closer here. And my pressure is through my thumbs. Trying to get the rib to elongate AP. And do it again.
So by pushing into it, you're making it go
Yes.
more AP?
Okay. Very good. Now that doesn't seem like much of anything, but if you can concentrate it on the center part of the very middle of the convexity or
Yeah.
of the rib cage where it's tilted the most or rotated the most, then you can get it to straighten up. Just a few times.
Could she lean on something in a specific way?
It'll help the muscles and the fascia, but in order to actually restore it long term, you have to remold the bone.
Yeah. I'm just saying, like, if you just did pressure in that direction to elongate it this way, can she do anything at home to?
You know, I guess, I don't know, because you have to be really specific.
Yeah.
And then you have to impart the force through the torso at the same time. So it's not just this.
Yeah.
You know, brainstorming, like how else would you do this? Maybe if you put your hand here, it's right underneath the chest, right? Okay. Do you feel the ribs underneath?
Mm-hmm.
Okay. And then what you could do is lean right a little bit. I mean, this is rough.
Yeah.
Okay. And then you would probably, you know, have someone putting their hand here and you would push down. There you go. While you push inward. And then you lean, relax and lean, and do it again. Okay, so someone at home?
Mm-hmm.
Or,
a chair back?
yeah, something
Sit like a
immobile.
corner, yeah.
Mm-hmm, couch.
And this is maybe some of like the exercises that I've done with Dan try to like, I don't know, cut off is the right word, but try to like force me to
Are you hinging?
That side.
to breathe into this, like doing something with like my arm on the left, so that I'm only using this side, or that I'm only using this side.
Okay, yeah, that'll help. That'll help. And you can actually get one lung to expand more than the other just by thinking about it. So yeah,
Yeah.
you can actually breathe into
Yeah.
the part of the torso that you want.
So which side
Okay.
should I focus on breathing into for this one? Is it breathing into the left? Okay.
Okay, so go ahead and lie back onto your back, and let's check the sternum and scoot down until you're good. Is there anything you want me to go over?
The cranium,
Okay.
I don't know if you wanna just do an assessment.
And then is there anything that I can do for pain when this does turn on? Cause like it wasn't hurting it wasn't hurting earlier. I mean, it turns on. It'll turn on anytime I'm like sitting on the computer. Um,
So if we look at her thoracic and lung, it actually looks a little better.
Yeah.
Now, to answer your question, I don't know. Like, should you roll your back? You roll your back with a foam roller?
yeah, and I have like, you know, balls that are like bigger than tennis balls that like I can lean into and like do some myofascial with, but it's very temporary.
Okay. So, do this remolding of the rib thing so that you get more of a resolution of why that keeps returning. Because it's how your torso is compressed. So if you restore the symmetry of the torso, you'll probably get less facilitation back here, okay? Or turning on of those muscles, right? Does that make sense?
I wasn't listening, I'm sorry.
It's okay, you can listen to it later. Okay, so let me go back and retest the RCPM, see if it's any different. I think it's better, I don't know, what do you think?
Yeah, it feels like there's less compression. I just wonder if it goes into that so that this doesn't hurt. You know what I mean?
You mean that this is related
Yeah.
to that? Well, it most likely is. But the more we keep restoring parts of your body, the more it recognizes a neutral, safe zone,
Yeah.
where it's supposed to be naturally. So she used to have, as far as cranial strain patterns, compression, left rotation, or left torsion. I think she had a right side bending rotation, that's gone. The left torsion is very minuscule. And I thought there was one more. I can't remember. But if I look at the face and the landmarks, they look pretty even.
Hands stay right where they are.
This way, the frontal bone is a little high on the left. So is the maxilla. So this left torsion is persistent. So I wonder, what did we find down there in the anomaly?
You said that there were, your
This
pelvis
was-
was high.
Yeah. Yeah. So the left innominate is related to the temporal bone. Alright, so let's, this might not fix it for, this one time, but over time, as long as we keep treating this, then the
help the
temporal
temporal
bone will start to be more stable up there. Not stable because it's not unstable, but it's just in the wrong position.
Yeah.
So this is what I would do. I would restore this. Okay.
It's a straight arm.
Bend your knees.
You can always know all that.
And this one too.
Arms stay straight, you start to lift the head.
Let's make sure the pubic bone works.
That's what brings you up. Yes.
Push your knees together
That's what does it, yes. And then exhale to release.
and relax.
It's like you're a baby
Do it
on
again.
the floor, wanting to look up
And
at what's going on. So you're using
right.
those muscles.
scoot to the left enough so your buttock feels the edge. And bend this right knee.
Tone behind the lungs, behind the shoulders.
And bend this knee.
Upper back.
So I have my hand on the ASIS. It's rotated backwards, so
Inhale,
I'm going to use muscle energy to de-rotate it. Push your knee up toward the ceiling
and stretch the breastbone.
and relax. Do it again. And relax. Do it again. And relax. Okay, bend your knee. Good. And relax. Okay, slide to the middle. Retest. That was a little better. So now I'm going to come up and just probably balance the head since we're running out of time.
It's different, yeah, there's something, it's strong shoulder muscles.
So we've got
So here you're teaching
a pelvis that's rotated backward, torso's kind of side bent left, rotated right, everted ribs on the left, rotated thoracic inlet, scalenes that are hypertonic on the left, and then an unbalanced cranial base. But much better than before.
Yeah.
Any questions? This is how my thought process works every single time.
I love it. It's so different. It's so whole body, you know.
So it's always, I'm always looking at joint symmetry, alignment, skeletal alignment symmetry, feel for range of motion and feel, is the tissue, is there a restriction in fascial mobility? So it becomes kind of like a search all over.
Yeah.
And in the process, sometimes you awaken the other things up, like this has now kind of festered.
Yeah.
But as long as we keep unraveling.
Yeah. And what
She's
Dan
not
is
done.
doing is kind of breathing into areas that she's avoiding. So it changes the rib position. I think that changes the
Yeah.
spinal curves and the position of the head and neck.
I'm finding breathing is a great way to stretch without me doing any of the work. I just say breathe, and
Yeah.
they've done a stretch already through the entire spine. And with the dural system.
Yeah.
So, that's very neuromuscular. Just
Yeah. Yeah. Awesome.
All right.
Thank you so much.
Thank you.